It's going to affect most of all the functioning in these persons. It's going to affect, social life, occupational life, areas. Duration. So if someone has these symptoms for a week, it's not going to be a diagnosis of schizophrenia, obviously. Schizophrenia needs to have a duration of at least
6 months.
6 months, yeah, more than 30 days. So 30 days, 6 months for the diagnosis of schizophrenia. However, if the treatment is given, then the length of stay can be decreased because the patient is being effectively treated with medications. But usually, once the diagnosis of schizophrenia is being made, it's a disorder that is going to be chronic, and it's going to be a lifelong illness, mental illness. As I said, it's one of the most severe mental illness that we have, and it's very disabling. And most of these people can go into a chronic condition that may require frequent admissions to the hospital. So the goal of treatment would be to decrease the frequency of admissions to the hospital and also decrease the severity of positive and negative symptoms. And the treatment of choice for psychotic disorders would be medication management. I think there are some therapies that can be used, group therapy or individual therapy, but more or less to help patients cope with their daily living. But it's not going to be a therapy that's going to really cure or treat the psychotic disorder. They can have therapy, for example, where they can receive psychoeducation about medication management, about compliance with medications, so they can help them cope with intensity and frequency of hallucinations or when to seek help. So there is a role for therapy. It's going to be more like a supportive therapy, as opposed to going into deep psychoanalysis, trying to understand the deep world, subconscious world of schizophrenia. So it's more a supportive therapy. Okay. Anything else?
You have to exclude schizoaffective and mood disorders.
For schizophrenia, absolutely.
And then also exclude medical conditions or substance use.
Yes. As I mentioned at the beginning, there are other psychotic disorders, and among those, there are psychotic disorder induced by a medical illness. So medical illness can produce psychotic disorder that mimic schizophrenia, but it would be a psychotic disorder induced. For example, a brain tumor, can bring delusions, paranoia, hallucinations, or systemic illness like lupus can bring it, or even medications can bring it. Like drugs, amphetamines, stimulants, or any medication basically can produce it as well. So you need to rule out that it's not induced by a medication, by a medical illness. There's not a brain tumor. Usually, depending on the symptoms, you may even require a CAT scan of the brain to rule out any tumors, for example. Anything else?
Mm-hmm.
Excellent. So now we covered schizophrenia. There are other diagnoses that need to be covered, and probably in the future we'll be covering one of those diagnoses as well. Okay, thank you very much.